Hi everyone, I want to talk about toxic shock syndrome, but I'm going to limit myself to symptoms and diagnosis right now. Okay, toxic shock syndrome. Let's go. Toxic shock syndrome is secondary to Staphylococcus aureus infection. It was first described in 1978 in pediatric cases, but in 1980, more cases were associated with menstrual periods. Menstrual toxic shock syndrome is also known to be associated with tampons use, particularly when a single tampon is kept for a very long period of time within the private parts of the woman. Toxic shock syndrome is not limited to pediatric or menstrual period alone. It can also be found in post-influenza respiratory infections. It can also be found in enterocolitis, perianal sized lesions, that is when there are cuts or abrasions in perineal area. Axillary lesions, secondary to burns, secondary to arthritis, secondary to osteomyelitis, even sinusitis is not left out as possible source, and anyone with infection generally could be the source. So you've just heard that it's not only menstrual related tampon and all this sort, it's not only in children, pediatric age group. You've just heard me when I gave you the list of different routes through which you can get toxic shock syndrome. Now, you want to know the particular agents concerned. I've mentioned Staphylococcus aureus, but the Staphylococcus aureus could be methicillin sensitive one, and that would be good because it means it could be handled more easily. But when it is methicillin resistant Staphylococcus aureus, not that it could not be handled, but we have more job to do. So it's either methicillin sensitive Staphylococcus aureus or methicillin resistant Staphylococcus aureus. The Staph aureus produces TSST1, that is toxic shock syndrome toxin 1. The toxic shock syndrome toxin 1 is an exotoxin. Other heterotoxins are possible, and that could be heterotoxins A, B, C, D, and E, and even H. No prudency here because toxic shock syndrome toxin 1 has no purulent response. It also represses the production of other Staphylococcus aureus exoproteins. Enterotoxin B has the same characteristics. Immunity affects the rate at which the toxic shock syndrome will bring down the affected individual. What are the possible clinical features? Yes, your friend has toxic shock syndrome and you're not sure, or you are a healthcare provider, or yourself or your family members want to be sure. Okay, let's go. Within the first 48 hours, there'll be fever, and the fever will be very high grade. Use your thermometer and you see very high grade. Somebody who has not been down before, suddenly, and is rising and is very high. When you check the BP, it will be down. Okay? And there will be rashes that's going to spread wide. Macular erythroderma very diffuse. And desquamation, that is, you check the palm, you're going to see as if it's peeling off. Okay, desquamation with headaches, memory loss, decreased level of consciousness, encephalopathy, and the individual could even be convulsing, seizures, all within 48 hours. There's possibility of shutdown of platelets, thrombocytopenia, and that will lead to bruises, ecchymosis, fatigue, and bleeding. When the individual gets to the hospital and they check the liver enzymes, they'll be rising. Vomiting and diarrhea could be present, joint pains, and when CK is assay, it will be high. Hyperemic vagina if you check the region, and conjunctival hyperemia when you check the ocular region. Dermatologically, there will be diffuse red macular rash on the soles and palms. And when there is edema, it will be non-pitting. The Center for Disease Control issued criteria for diagnosis of toxic shock syndrome, and that includes fever, hypotension, diffuse erythroderma, desquamation, and about 3 organs will be involved. You rule out other likely causes, but you don't have to meet all these criteria before you diagnose toxic shock syndrome. So, when you go to the hospital, they're going to tap your back for CSF, lumbar puncture for cerebrospinal fluid, and that will be culture. Your blood for blood culture. Then, when renal function is examined, there will be increased blood urea nitrogen and creatinine. Liver enzymes will be raised, like I said before. And for myalgia, they're going to check creatinine phosphokinase that will be rising and increase immature neutrophils. The hematocrit will be down, and PT and APTT will be rising because liver is in trouble right now, and of course disseminated intravascular coagulopathy. Parameters may be normal within 8 to 12 days. Because of the rashes, the fever, the central nervous system involvement, and all other clinical features, it's going to be wise to do serological tests for measles, Rocky Mountain spotted fever, and leptospirosis. And you know what? All will be negative. Okay, the next is going to be presentation on the treatment and differential diagnosis of toxic shock syndrome. Thanks for listening. Kindly subscribe to my channel so that you can get these publications immediately they are released. Thank you.